My name's Andrew Raynes. I'm the Chief Information Officer and Director of Digital at Royal Papworth Hospital. I have a department that I run about between 70 and 80 staff, covering ICT, telecoms, project and programme management, health records and information governance. Becoming a GS1 digital exemplar would be a fantastic achievement. I think, however, it has to be said, it's fundamental. GS1 is, I think, in terms of providing safe and efficient care. So I think if you look at other industries whereby things like, for example, barcode standards are being used, healthcare sometimes seems to be lacking. I think what's exciting about being a GS1 exemplar is how much we've invested and explored that area. For example, using track and trace technology to be able to use things like GS1 compliant patient wristbands, for example, so that we know where our patients are, and we can use the patient and track them to rooms, or we can track them to services or equipment that we use with that particular patient. In terms of our medical devices, we're also tracking and tracing those pieces of equipment. That means that for our staff, that we're making sure we're as efficient as possible, spending less time looking for stuff and more time with our patient, which is the imperative. That's what our business is. GS1 is technology that enables us to be efficient and safe, and I think that comes as standard. A new hospital such as Royal Papworth Hospital, and being an exemplar, is a perfect opportunity for doing that. And we've looked at making sure each of our rooms in that hospital has a global location number to make sure that you can track and trace something to any room within that hospital. That has got to offer huge patient benefits in terms of safety, track and traceability, and knowing the organisation, giving us grip. 2018, there are clearly many challenges. Certainly achieving the multifacets of providing modern, dependable healthcare is really important, but a challenge in itself. Many initiatives that are underway are like juggling many balls. For example, we've done a lot of work around business change in the organisation to prepare it for a move into the new hospital. Healthcare-wise, that's been a huge issue. Finances are always a challenge for organisation, whereby you're trying to make sure you're using and spending money wisely and being efficient as an organisation. I think trying to juggle the many plates that are things like ensuring your systems are sustainable for the future, and ensuring that patients have the very best treatment and care, and that you're staying ahead of the curve to ensure every experience the patient has is one which is safe and effective for their visit. Real opportunities, I think, for healthcare have to be, I think, for sustainability, is working differently, looking at how things like interoperability, for example, between technologies can harness the patient experience and provide a more seamless service, whether you're seen in one area or move to another area of the country, that your health record can follow you, that other services, as they need to, can access vital information about you to support your care. And I think that's what our patients expect. And I think there's a massive benefit around the work of GS1 and the Scan for Safety initiative about reducing never events. And GS1 has a real opportunity, I think, to play in making sure never events are a thing of the past. It should be in every organisation. If you go onto a farm, you can actually test the consistency of a cow's milk. And yet, how is it that if you go into a hospital, we can continue to perhaps have an error where a patient perhaps leaves the hospital with a foreign body inside them that we are potentially unaware of? It's something of the past that we need to rub out, and technologies like GS1 we need to exploit but not in a new way. It should be a standard. It shouldn't be something like actually you should achieve. Every organisation, every healthcare organisation should have it.